105.1 The Buzz with Daria, Mitch, and Ted. We welcome to the show cosmetic surgeon, Dr. Michael Workman.
Good afternoon.
Good afternoon.
How many, welcome back, Dr. Workman. How many devices of like an iPad nature do you have? Because each time you come in with only one or two, but they're always different sizes than they were the last week.
A few.
Several.
So listen, I wanted to share this with you. A new study found out that this is the time of year right now, the first 2 weeks of November, that you're more likely to get a cold than any other time of year.
Great.
Excellent.
So if you're staying pretty good these 2 weeks, then you're doing pretty well. If Purell now is not going to help, Mitch.
Can't hurt.
How much Purell? How much Purell do you go
I don't
through?
use that much. I brought this in like a couple days ago, and I haven't used that much.
Oh my God! It was like a third of it gone.
That's not bad. I brought it in Monday.
Oh, it's a 3-gallon
only
jug.
Wednesday.
But the study also found that we don't feel great all the other 50 weeks of the year, that between illnesses, headaches, hangovers, and injuries, we only feel 100% healthy 171 days of the year. So if you have a feeling like, oh God, I'm always feeling yucky, then you're not
alone.
You're in fact normal. I know that you're above average, Dr. Workman, in all things. But when that comes to having a surgical treatment, are there stipulations before you go into having a certain surgery? Like, do you have to, what if you have the flu, or what if you have a respiratory infection, or that kind of thing?
Yeah, I think there's some basic guidelines prior to having surgery. One is you don't want to be sick. And by sick, I mean, if you've got just a mild, snuffy nose or whatnot, I think that's fine. I think that if you've got a fever over 100.5, your surgery will be canceled. You don't want to have an infection anywhere else, like a urinary tract infection or any other type of infection going on actively when you have surgery. And
what about a previous surgery or operation? Like if you're still technically healing from something like, say, maybe gum surgery or something.
Right, your gummer. I think it's important
What?
then.
What just happened?
I don't even know.
Those people are referred to as gummers.
The old gummers.
I think it's important. It depends upon the type of surgery. I think that one of the things we're getting more and more concerned about is with successive surgeries, there's a higher risk of having a blood clot. So, for instance, let's say if a woman's on the pill and has like a knee or a hip procedure, both of these things make it one more likely to get a blood clot going to the lungs. So, oftentimes we'll stage surgeries 2 to 4 weeks out to minimize the risk of that. In terms of healing, if it's a minor surgery like an oral procedure, in most cases, it shouldn't interfere with having another larger procedure. But obviously, you don't want to have a bunch of big surgeries, week after week.
We're talking to Dr. Michael Workman. And speak for yourself, Doc. No. We're talking to Dr. Michael Workman. He is a renowned plastic surgeon in the Pacific Northwest area. He specializes in breast augmentation, tummy tucks, etc. Everything from the neck on down. So what about something that's weight related, like if you have, if you want a tummy tuck or any sort of body procedure, but you're not at your ideal weight? What do you suggest in terms of you shouldn't do any sort of surgery in place of getting in shape, right? It's not like, well, I'm just not going to work out.
Right.
Yep.
I will get the liposuctioned tummy tuck, and then I'll just be like,
That'll be fine.
relax.
Yeah, no, absolutely. I mean, I think clearly plastic surgery is not designed to replace diet and exercise.
I know. Someday, though.
But
Someday.
having said that, I think the general rule is if one is within 10 to 15 pounds of their ideal weight, it's fine to go ahead. Let's say for breast surgery, your breasts probably aren't going to change dramatically if you lose 10 pounds, or same thing with the abdomen.
But your breasts will be different if you have recently been breastfeeding or pregnant.
True. I think generally after pregnancy, or specifically after breastfeeding, one should probably wait a minimum of 3 to 6 months so that the breasts, fully involute. They get, we never like to operate on a moving train, so to speak. We want to make sure things are at a kind of a steady state in terms of, especially with breasts in particular. So normally 3 to 6 months following, cessation of breastfeeding is what most people would say.
When you say ideal weight, does that mean what is on like obesity charts,
No,
or does it mean
let me get a look at you and I'll let you know.
Yeah.
does it mean what you ideally would like to be, or what's the standard you mean when you say ideal weight?
Yeah, that's a really good question, Daria, because oftentimes people are overweight based upon, insurance charts or BMI, body mass index, but that's where they've been living. So for instance, I'll say to a person, what weight do you think you'll be at a year from now? And if they say, well, I'll probably be down 15 pounds, I think that it's probably reasonable to go ahead. Now, so ideal weight is ideal for the individual person, okay? Now, having said that, if let's say your normal weight is 400 or 500 pounds, you probably need to lose some weight before you do surgery.
You can answer, or rather get answers to a huge range of different questions when it comes to future plastic surgeries, plastic surgery in general, by attending the 3 Doctors, 1 Goal seminar that's taking place tomorrow night. That's going to be at 6:30 p.m. at the Sentinel Hotel, and it will be Dr. Stafford, who's a cosmetic dentist.
Yep.
It'll be our own Dr. Michael Workman, and it will be Dr. James Chan, who does everything from the neck on up. You can find out more information and put your name down for a spot at this seminar by going to 3doctors1goal.com. Again, it's tomorrow night, so there may or may not be spaces, but you can find out more about what these sort of seminars entail. In the meantime, if you want to know more about surgeries in the long term, you can just go to Dr. Michael Workman's website at drmichaelworkman.com.
Thanks, Doc.
All right, my pleasure.